If a patient comes in with some muscular neck pain, it is just tight and uncomfortable, and stretching is just not helping. Here are some things that I might start with for treatment. For patients with this type of pain, I love to use manual therapy techniques and doing soft tissue work to the neck and upper back. I find this to be extremely important in gaining pain-free mobility and working on pain management while we also work on the long-term fix. Isometrics are a great way to start, where you're producing a contraction without a movement, so just pushing enough to turn the muscles on but not doing repeated movements. I like to do these holds in side bending as well as working into flexion and some extension to light up the back of the neck, only contracting at a percentage that the patient can tolerate where it doesn't produce much pain. Of course, upper back and scapular work is super important with neck pain as well, so I work on getting the shoulder blade moving in a pain-free range of motion and adding that in combination with shoulder extension in this T position, adding a little bit of weight if the patient can tolerate it. And then especially for my people that sit at a desk and that is related to their pain, I like to do a bit of thoracic work, doing some foam roller thoracic extension, controlling for movement at the lower back and the neck, and just trying to isolate that mid back. And I always prefer to follow up passive extension with active, so doing some type of Superman with your arms by your side, out to the side or overhead, depending on the level of difficulty needed. And depending on how annoying that upper trap is, I might do this version of an upper trap shrug that gets you some good recruitment, but also a little bit of a stretch. Remember, in this case, I'm talking about a new patient that comes in with a decent amount of discomfort, where we're really working on pain-free range of motion and pain management at first.